Okay, hi. So I want to talk about something that's bothering me, and I don't know exactly how to explain it other than the situation feels suspicious. So you tell me, but I don't like the vibes that Healthcare Connect is putting out right now. Here's the deal. I'm Canadian, I live in Ontario, and although I was born and raised here, I spent some years in British Columbia. During that, the pandemic happened, and my family doctor in Ontario pressured me into disconnecting with them. And I did because I wasn't sure when I'd come back. I didn't want to be a jerk. I moved back to Ontario in 2021 and have since been on Healthcare Connect waiting list to get a doctor. My old family doctor wouldn't take me back, and my partner's family doctor is full up and not accepting anyone new. Healthcare Connect over these years has sent me letters every couple months to remind me that I am still on the list, which honestly just stings a bit to be reminded this has taken so long, but is technically helpful to know that I haven't been forgotten anyway. A few days ago, I received a couple calls from an unknown number, which I did not answer because I don't have a cell plan for calling, and it was presumably Healthcare Connect trying to contact me, but I don't have voicemails to confirm. Then on May 8th, I get a text message that says, Healthcare Connect. The Ontario government is working to connect you to a family doctor or nurse. We are contacting you to ensure we have your latest information. You can update your contact information by emailing or calling. And I would like to point out, if it's not clear, this is not them contacting me to say that they are currently connecting me to a doctor. All their messages over the last years have been worded like this. They are perpetually working to connect me with a family doctor, and this is just about me confirming my information. So I do. I send them an email through the one they have on file with my name and address, and I ask whether there's anything else they need. I get a no reply email that I don't open, and I think that's that. Not 2 days later, I get a letter in the mail that reads as follows: Dear me, this letter provides an update on how the Healthcare Connect program is helping to find a primary care provider, such as a family doctor or nurse practitioner, faster. Ontario's Healthcare Connect program is being improved. On January 27, 2025, Ontario announced the Primary Care Action Plan, including the commitment to attach everyone as of January 1st, 2025, on the Healthcare Connect waitlist to a primary care team by spring 2026. Sorry, that was a mouthful. What to expect. You will receive a call and or email from one of the program's care connectors in the coming weeks. The purpose of this outreach is to verify and update your contact information and confirm that you still are searching for a primary care provider. This will help us connect you with a provider faster and ensure we have your latest information. Your Care Connector can also provide information about local healthcare services that are available to you while we match you with a local primary care provider. You may also be contacted by local primary care providers that can provide you services while you wait. How you can help. You are asked to contact a Care Connector by phone or email. Please include first and last name, address, reason for updating information, e.g., moved, already found a primary care provider. You can also visit their website or call 811 to connect with a registered nurse, day or night, for free, secure and confidential health advice. And okay, cool, sure. But this is where things start to feel a little off for me. This pledge and these actions started taking place in January, but they haven't contacted me about anything until the end of May. I know government processes take time. They can't mass reach out to everyone at the exact same second. But I also know firsthand how government slow processing can be used as a loophole by those systems to make disadvantaged people even more so by putting them in a position of being non-compliant to a deadline. That worries me, but that's just paranoia from having been on Ontario Works before and trying to move apartments. What I actually don't like about this letter, other than the typo, is that only then did they tell me what information they wanted me to email them. It just so happened that I correctly assumed and gave them my name and address, but I didn't provide a reason for updating my information, because the reason I emailed them at all was because they told me to. The fact that the reasons they show for updating information is listed as moved or already found a primary care provider gets me a little sketched out that since I didn't list a reason and those are their first assumptions, I should confirm that yes, I do still need a doctor, because that seems obvious but perhaps needs to be said directly. I'm sure they didn't want me to email twice, but I sent another one exactly as specified in the letter to do. And I did just straight up tell them I'm updating my information because they literally told me to. It's such a stupid thing to ask. So I got another no reply email from them. I read it this time, and it says, "Thank you for responding to the email, text, or letter that you received from Healthcare Connect. Please note the following options. 1. If you have already contacted Healthcare Connect to confirm your information, no other action is required at this time. You may disregard any additional communication from Healthcare Connect related to updating your information. 2. If you continue to require a primary care provider, please submit only one email with all of your contact information and health card number. We will contact you when a provider becomes available. 3. If you have found your own provider or wish to be removed from the Healthcare Connect list, please let us know and we will remove you. 4. If you wish to update your health status information on your file, please call." Now listen, I could just take number 1 at face value and leave everything alone and sleep tight at night. But why is number 2 so broad that it still literally includes me? I do continue to need a care provider. I sent 2 emails to confirm my information already, and neither of them had my health card number because none of the 3 other forms of communication they sent me asked for that. So although I'm sure it's fine and they're trying their best and that text messages can only be so long, but why is it that every time I get one step further and think I've done all that they wanted from me, that there's some new little bit of information they wanted that I didn't provide? It makes me a little worried that for some reason that is going to make me non-compliant and take me off the list. I don't think our government is so outright nefarious that they're trying to take as many people off the list as possible so that they can actually fulfill their quota by withholding technicalities with which to do so. But that is the underlying intent here, to take people off the list. And I understand that people who do not reply or confirm their information are those you don't want to be prioritizing to give doctors, because logically, they won't reply and hold up the line if and when you do try to contact them. That makes sense. But until someone outright tells Healthcare Connect they do not need a doctor, they should not have to keep reconfirming their need. It is on those who do not need to be on the list to remove themselves. It should not be the Healthcare Connect's directive to seek out people to take off the list. Sure, send out letters to say people should remove themselves, not require action of those who have been and are still waiting on a doctor for years now. Nothing has changed, and the slow and inconsistent process they use to reach out to me does nothing but breed room for error when they didn't give the same information across every form. If I am not connected with a doctor in 2026 like they promised, and it has anything to do with me not also confirming my health card number, which doesn't change and they already have, I will be very upset.